Hello, everyone, and welcome to the show. Today we'll be talking VA Straight Talk. Our subject is homelessness. As you know, across the country there's an epidemic of homelessness. Our veterans are part of that, so we want to get some information out about veteran homelessness and those programs. We'll be talking with Amanda Doemland, homeless program coordinator at the VA SORCC in White City, Oregon. Welcome to the show, Amanda.
Thank you, Andy, and good morning.
Good morning to you.
Thanks.
And first, let's talk a little bit about you. So, you're here in Oregon. How did you get to Oregon? Let's talk about that first.
Well, I came here by way of Texas through Virginia, and I've been working with the homeless programs at the VA since about 2008. So I started as a frontline worker, and as the years have progressed, I've just become more and more committed to the VA's mission of ending veteran homelessness. I got in right at the front end when President Obama and Secretary STandDowns began their initiative to end veteran homelessness within 5 years, and that's continues today because it turns out that it remains a very complex issue with lots of moving parts, and it involves so many different pieces and members of our community to try to end veteran homelessness.
Okay, is there any homeless situation that really touched you and kind of gave you passion to do what you do?
Sure. I'd say when I first got into the work with veterans at the VA, I really was one of those people who maybe didn't often notice homeless veterans on our streets in our community. It just wasn't something that was on my radar. So then when I started working at the VA, I actually had the opportunity to really meet veterans who are experiencing homelessness, hear their story, and what I found was many times they're just moving through a system that doesn't take time to hear what those issues are, or hear what happened. So that I stopped and listened, and through that I became very passionate for the cause. And then I think the other really impactful experience I had was I would go and meet veterans in the community, the prior community I lived in Texas, at a shelter, a food soup kitchen, and I had to stand in line with some of our veterans, and it's a very humbling experience to stand in line outside and wait for a meal. Mm-hmm. And so once you kind of experience that maybe many people haven't, it definitely opens your eyes and gives you a new perspective about the depth of this issue, because I was standing there not only with veterans, I was standing there with women and children and families, elderly, anyone. You would not know who to expect to see in that line.
Okay, good. So can you give us a general definition of homelessness?
Yes. And there are various definitions out there, but the one that the VA is using is coming in line with all of our federal partners, which basically is that we look at someone that lacks a regular, fixed, adequate nighttime residence. And oftentimes we count places like shelters and places not meant for human habitation, basically. So that could be a car or outside, a tent, many different places that the defining feature, I guess, is that there's no regular fixed nighttime resident.
Okay, I know that when we see homeless people, a lot of us just turn away, or we won't talk to them, or we don't understand the situation. I think it's important that we let people know that there are a lot of different reasons that people can become homeless, and even people in really well-off situations today, if something happened, a tragedy in their life, loss of a job, loss of a loved one or something like that, can impact your life to the point where you actually can become homeless.
Absolutely. So, I would say that oftentimes it's related to mental health issues, substance abuse and addiction issues. There's a connection between veterans or anyone that gets involved with the justice system that can lead to that, a loss of income, you know, an unexpected injury or something that would allow someone not to have a regular income, that then also many people live paycheck to paycheck. And there's multiple reasons. Fleeing domestic violence, that's another reason that people become homeless.
Okay, so there are different levels of homelessness. Can you kind of go through those and define them for us?
Correct. Yes, there's the basic one about someone that doesn't have an adequate nighttime residence, and then we also have a special category that we define as chronically homeless, and that means that it's someone that has no adequate nighttime residence. They have a disability of some sort, and they also have been homeless on the street for a year, continuously for a year. Or we also look at it as 4 episodes within 3-year period of just episodic homelessness. So if a person meets those criteria, they kind of bump up into a category of chronic homelessness that we really are currently in the VA and in the community, I would say, focused on. We often refer to that as those that are the most vulnerable with the highest need, the highest acuity, just because our mission is really to find those veterans that are at the greatest need and really try to assist them first.
So a lot of times people are living in garages, on people's couches, with their parents, friends, something like that. Where does it become homeless according to the VA? At what point am I actually homeless when I'm looking for the VA?
Sure. Well, unfortunately, couch surfing, which is what you just described, where you're living with a family or doubled up or staying on someone's couch, is not meet the threshold for how we currently define that. However, we do recognize that an at-risk of homelessness is, there's a definition for that, and generally that's looked at as within a 14-day period. Someone has a documented evidence, such as an eviction or a notice that their home is being sold or something, so that within 14 days that pumps someone into that category that we can prioritize for additional services.
Okay, so what is the scope of homelessness according to the VA?
So nationally, they looked at it in the beginning of the initiative in 2010, and we realized it was a very large problem for veterans. And as of, I believe, 2016, nationally, the number of homeless has dropped by 50%. And I think people could possibly be disappointed that we haven't already accomplished our goal. And in fact, the target has kind of changed, that now we're looking at community by community. We realized it can't just be done at this national level, that we need to drill down into the community, an individual community, and see what supports are currently in place and are strong, and where we have some gaps, and so that we can really hone in on a community level about what we really need to beef up so that we can meet the local needs.
Okay, so when we look from the past, how homeless was, say, 10 years ago, and we're looking into the future, what does that view look like, and how does it impact our community?
Well, the approach to ending homelessness has also been changed recently based off of some evidence-based practices and research where we've really flipped our whole approach to ending veteran homelessness. And one of those features is to really look at housing as a fundamental human right, and or housing as health care. So we really try to, and it's now referred to as housing first. So the idea is that we get people off the streets as quickly as possible into some housed situation, followed by supportive services, which could be mental health counseling, substance abuse treatment, helping someone regain or apply for income so they would have a ongoing regular monthly income so they can afford to pay rent. We have a very large partnership with HUD, the Housing and Urban Development, which provides us supportive housing choice vouchers. That in this partnership, HUD supplies the Section 8 vouchers, and VA supplies the supportive services, the wraparound supportive services.
Okay, it kind of sounds like there's a strategy an approach to homelessness that you have. Can you kind of take me through that strategy? Where do I start? I'm homeless. What's the strategy? What are you looking at first? What are the things that are going to get me to services that I need immediately?
Well, we really approach addressing veteran homelessness along a continuum of services. And if we want to think about it, sort of the lowest level of intervention to the greatest level of intervention, those early stages would be outreach, education, prevention, so that really it's much more cost effective if we can assist someone in preventing becoming homeless before they are. It's much more expensive to do it after the fact when someone's lost everything. So so prevention is our first arm, I would say, that we have people that are staff and that do outreach, education at all levels, at the individual level with a veteran, or at our community partners, and as a community. There's a continuum of care in many communities, and we have one here in this community that really approaches looking at homelessness collectively, so that we can figure out how can we get the resources and education about where to go. If you start to struggle, where are those initial places touch points, so you can get the least amount of help that will keep you stable in your housing. If that doesn't work, we also then move to different options, more heavily weighted along this continuum. So we also still have traditional short-term transitional housing programs that someone could come in from up to 30 days, 90 days, or 180 days. So there's different kinds of programs that take different time slots, whether that's an early shorter term intervention, or someone may have quite a few barriers to getting back on their own.
Okay.
So that would be transitional housing.
Okay, so as I listen to the program and how it's put together, at first when we talked about what is homeless, how do you access the services, I'm in denial. I know something's gonna happen for me, but I'm staying at my mom's house or at my friend's, but I got a couple weeks to stay there. That sometimes looks like homelessness, but not really to the point where the VA is gonna step in until you are actually in that position where you don't have housing now, correct?
Well, no, we do have some programs that's on the preventative side still. So someone who's concerned that they may become homeless soon, or concerned about, I would still encourage people to reach out and connect with some of these services. For example, we have in our community, Access is one of our community partners, along with UCAN in Josephine County, that are points of entry to get preventative services, short-term assistance, to really maybe talk to someone who's going to look at the reasons why they're at risk of homelessness, and then try to see if we can connect them with and link them with the services that would assist to prevent that.
Okay, yeah. So I'm really trying to see how to access those services. What are the steps you go through to do that? You gave us a couple of places that are access to services. Are there any more that we would like?
They could come to the VA. If they're a veteran, they're welcome to come to the VA, and we have a homeless department, and we also provide services, walk-in services on a daily basis, Monday through Friday at the VA in our, we call it One Door. So that that's Monday through Friday, starting at 8, someone could walk in and say I'm homeless, I'm concerned that I'm going to be homeless shortly, and then we'll kind of do a needs assessment, see what we can do. We want to save our most limited and precious resources for those that we're able to find that are most in need and vulnerable.
Okay.
So sometimes that's a misunderstanding that when people think, oh, VA is offering housing for people, there's a perception that we're in the housing business per se. We're in the supportive services business to help people get that housing, and so there's some education that goes along with that, but just a thorough needs assessment from the beginning. Sometimes we can provide limited support and then get them on their way, and some people will need much greater services. And so at the VA, I just want to continue on the continuum. So we do outreach and education. We have the transitional housing supports. We also have residential treatment out there at the VA source. So if someone is experiencing homelessness and has some other treatment-related issues, substance abuse, mental health, they could also come in and get treatment. And then we also have a community employment coordinator who assists veterans who want to, are able and willing to try to go to work.
Okay, I know that this is a huge problem, and I'm aware that the VA can't do it all by themselves.
Correct.
So there's got to be some community partnerships and collaborations that go on. Do you know any in our local community that we can talk about?
Yes, there are many agencies, probably more than I can name, that are involved in this mission. But our local continuum of care is probably the organizing force of that, and that would be our a meeting where all of our community partners that are involved in this mission come together and strategize and make sure that we have we're not offering too many of the same services, or that we don't overlap, so that we can have a good continuum of resources with our community partners. But they are many of the social service agencies that we think of, like the Salvation Army, Rogue Valley Veterans Community Outreach. Easter Seals has a homeless veterans program.
I know we cover a large area, or I know the VA source is like a hub for kind of Southern Oregon. So there's a large area that they cover. St. Vincent de Paul,
Yes,
do
sorry.
they have homeless programs there? And this is a big issue, and
Yes.
there's more that we need to look at than just our veteran population, because sometimes they're not out there alone, and as we share these resources, and sometimes they don't want to talk to the VA for whatever reason.
Correct.
But their community partners can get them started on their way.
Yes.
And to what's available there, and also what the VA has to offer. So I know Grants Pass is part of our catchment area.
Yes, it is.
Right? So the Grants Pass Gospel Rescue Mission, that's one of the partners. I'm understanding that.
There's still yes, there are missions in our community that provide just emergency shelter, and that's kind of an entry point as well for people to kind of have shelter and food, number one, and then hopefully get connected to those agencies appropriately. It could be, and I wasn't able to name them all. There's so many.
We talked earlier, and I have a couple of those, because I
Okay.
wanted to just make sure that we highlight a couple of those that are in our local area.
Sure.
Ashland is one of our communities, so in the Ashland Resource Center,
Yes.
people can get there. And I talk about Ashland because there is a lot of transient population that comes there just because of the area that it is. And our veterans are part of that, and I just like them to know that Ashland Community Resource Center is a place that you can go when when you need some assistance.
Yes, and as we approach the cooler months, I believe last year there was several warming shelters that would pop up and be available for people, and that's just can be a life-saving measure sometimes for people to just have a place to go so that you don't freeze.
Yeah, can you tell us a little bit more about warming shelters and how they kind of decide what day we're going to be open? Is there like a temperature gets to 32 and we're going to try to help a few people out?
Well, I actually don't have those specifics here. I would say that that's not my. Yes, we refer to them,
Okay.
but it's not my focus, and I don't want to speak inappropriately about that.
Okay.
But they do exist.
Yeah, I know that there are a lot of different avenues to get help and find shelter, especially in the winter. The VA also tries to assist homeless with a stand down, and that happens. Do you know anything about how that works and what time of the year that goes on?
Well, stand-downs happen across the country, and I believe they were started in the late 80s when they recognized that there was a particular group of veterans that were often reluctant to come to VA. That's Vietnam era, post-Vietnam era, when there was a different mood in our country, and many veterans were reluctant to seek assistance at a VA facility. So they came up with this idea to have these stand-downs, which were events that were held off-site somewhere. Typically, they would range from 1 to 3 days, and they were kind of just a pop-up resource event, and veterans, it was to encourage them to kind of come in and just check it out when it wasn't too heavy. You know, you could get some food, some shelter, some resources. Many of those stand-down events would have kind of a homeless or vet court that would kind of pop up as well to deal sometimes with maybe what we might refer to as like nuisance crimes, that having justice-related issues creates so many barriers for people that are homeless, such as if you have an outstanding fine or ticket or something and you are not able then to go and get your driver's license per se, or get a social security card or birth certificate so that you can move forward with getting employment, getting housing. So those events continue to this day. Every year there's 50 or 60 of them that happen across the country. We attempted to have one this year in September, or August or September, and it was unfortunately canceled due to the fires that we had this season.
Right.
But we will have them every year, and we're already planning for next year, and they're also held in our neighboring counties as well.
Okay, those organizations are kind of partnership with community resources also, right? Community comes out and provides services at these stand-downs for the homeless.
And in fact, these events are really driven by a community partner, or a veterans agency, or not always is it driven by the VA.
Okay,
and it's done that way so that we can involve all of our partners.
Okay, so if I'm homeless, it's getting cold, I need a sleeping bag or clothing, that also is something that can happen at a stand down. They have things to help people get through the winter who are homeless and don't have anything.
I mean, obviously, I think that everyone's first goal is to get someone permanent housing. Secondarily would be transitional or shelter. So our mission absolutely is to find people permanent housing, because that just gives a foundation for people then to get and receive those services that may be leading to or contributing to homelessness. And so a third really important factor in ending veteran homelessness is not just the physical structure of getting someone housed. It also involves social connectedness. And so just being inside a home is very valuable, but sometimes it's not enough. And so we also want to focus on the whole person. We also, at the VA, we have peer supports. We have a multitude of disciplines that try to work with veterans ending homelessness so that we can get them connected to their community. So through, whether that's through work, volunteer, some church, some activity that they're able to do to connect them. I like to just bring it down to the easy language, which is people need somewhere to go, something to do, and somebody that is expecting them. And that helps us connect to a community, and that really is an important component that we don't always look at. Luckily, the VA has really embraced a whole health model, a whole veteran-centric model to say, we're not just going to look at one piece, we're going to look at the whole person, and that involves looking at those extra social pieces too that connect us to a community.
So you're going to look at their situation and the things that could influence that situation. Is that what we're talking about when we're talking whole health?
Yeah, it can be that, but also just recognizing that people need a social connection to also be successful and stable.
Some kind of support systems
Yes,
and things.
whatever
of
that would
nature.
be for an individual.
Okay.
Some people have family support, some people don't, or
Right.
they find it a place to fit.
Okay. So we're about running out of time. So I've got maybe 15 seconds or so. Would you like to close out with a statement to our audience and let them know a little bit about homelessness?
I appreciate this opportunity. I hope I was able to adequately share enough about what our mission is, but I appreciate giving us this platform so that we can get the message out that we are a member of the community, also actively trying to end veteran homeless here.
Okay, thank you for being on the show. We really appreciate you being here, and thank you all for watching.